end also. So our next speaker was supposed to be Dr. Deshpande sir from Aurangabad, but because of family emergency, he has left yesterday to Aurangabad. So in his place, Dr. Prakash Marathe sir has been kind enough to cover. So he will be speaking on patient has sent a legal notice. What should be your next step? So this is a nightmare for any ophthalmologist. You are busy in your OPD and suddenly a paper lands on an envelope lands on your table and you open it and it's a legal notice from a lawyer or a patient, and suddenly your whole mood gets off. You don't know what is happening in the OPD, what is your OT list, and you lose the taste of your mouth also. But we have got remedies for that, and Dr. Marathe sir will be covering it.
Hello. I think the topic allotted to Dr. Deshpande sir is very, very important. So you have taken consent, you have written notes, you have done the procedure, everything has gone all right or might not have gone all right. What next? The patient has sent a legal notice. What should be your next step? There are few versions. Notice is there. Throw it in the dustbin. Somebody says that take it seriously, go to the lawyer. Somebody says that this is to be done, this is not to be done. There are various types of notices. The notice may come from the patient, maybe from relative, maybe from lawyer, maybe from government, and so many things. So the way you have to react is very important. So this is presentation by Dr. A. Deshpande, who is chairman of Legal Cell All India Ophthalmological Society and Maharashtra Ophthalmological Society. On his behalf, I am presenting this. So patient himself or through advocate, this is very important. Patient, suppose the sending notice to you, or advocate is sending the notice to you. Dr. Viral, please. Dr. Viral, please. And the notice is there, and some patients and hospitals, they say, we didn't get the notice. Somebody in the hospital has taken that, not given to the doctor. Still you have received the notice because somebody on your behalf is signed that it is received by you. Means you have not taken proper care and received that particular notice. The notice can be from civil court, consumer court. My previous talk was about consumer court. Then MCI, that is Medical Council of India, now it is National Medical Commission or State Medical Council like Maharashtra Medical Council, etc. It can be from police station, it can be summoned. Then criminal court called as warrant, it's very serious. That time you should be careful. Or other agencies as health agencies, corporation, etc. That can be about other things, biomedical waste and hospital registration and fire NOC. Ophthalmologist should take care of few more things, few more steps. He will not refuse the notice, as even if you refuse, it will be taken as granted. So take it. It is not mandatory to answer the notice of a patient and advocate. The notice has come. There are two options. You can answer the notice. Other thing is you may not. You may answer at the next step if you feel like. Because if you have answered, that particular version is again taken as proof. So you should be mentally prepared what answer you are supposed to give. Other notices answer with the help of advocate. Now in this case, three people can answer, means doctor or hospital. Second is advocate, and third is medical legal expert. So medical legal expert is the doctor who has got additional knowledge. Doctor advocate is the best combination. That is, you must consult medical legal consultant rather than advocate. Have an indemnity insurance. My next speaker will be talking about this. With good coverage limit and a medical legal consultant as advisor to keep yourself cool. Then don't become panic, even if you receive a notice. This is very important. When you receive a notice from a consumer court, you have to give a written statement in the consumer court to face and defend in a better way. If it is given with the help of medical legal consultant, it becomes more effective, just now I said, because he has additional knowledge of law as well as medical. He can represent a doctor better way than a normal advocate, and so you can win the case. See, there are some medical nomenclature, diagnosis, those terminologies. Routine advocate may not know that, but medical legal consultant knows that. On your behalf, when the advocate stands in the court of law, may not be knowing those nomenclatures, but medical legal consultant, definitely yes. He can help for maintaining the medical legal records, which helps in court to win the case. For that, contact medical legal consultant or the company. Whenever one receives a notice from advocate or court, consult medical legal consultant or a medical legal company and submit written statement with his help in the CPA case. You have to have your own notes, consult with medical legal consultant, prepare the draft, check the notes properly, see that if something is to be done, that has to be done carefully. Suppose something is changed with different ink pen, then it is objectionable. The sequence of events must be perfect. The day, date, time has to be put properly. Whether proper follow-up was taken or not must be mentioned in your notes. So in criminal case, give statement to police or present in criminal court through advocate with consultation with medical legal consultant. So complication is not negligence. This is very important. Negligence is different and complication is different. But not knowing the complication happened, not taking proper steps to rectify it, that is bad. Not referring or not taking help of proper specialist or leaving the patient on the unqualified or underqualified subordinate is negligence. You have a case. There is suppose IL drop and you haven't looked after that patient and you have told your subordinate to look after the patient like optometrist. Not a correct way. Refer the patient to VR specialist. He can take care. So proper step, referring the patient at proper time. If you are done, probably you are not in trouble. So taking proper step at proper time is must. Remember, the doctor will not be held responsible under negligence if the treatment is as per standard textbooks and or accepted professional practice and still patient suffers loss or injury. What does that mean? You have taken proper care, whatever is written in the books, and as per protocol you have treated the patient. Then it is not negligence. Or merely because a complication has occurred. So complications are known. They can occur. They are written in the textbooks. So if there is complication, does not mean that it is negligence. Only the thing is you should be able to defend in the court of law why that has happened and what proper precaution you have taken. This is about one court judgment, Supreme Court, in case of Dr. Suresh Gupta versus Government of Institute of Delhi. For it is held that for every mishap or death during medical treatment, the medical man cannot be proceeded against for punishment. So death does not mean, but unfortunately, this particular slide and what's happening otherwise, you know 304, 304A. So 304 non-bailable, 304A bailable. But most of the times police, they apply 304. And the worst thing which has happened in the case of Rajasthan recently, not 304A only. In addition to 304A, 304. And they have not stopped there. 302, that is worst thing, which was applied against medical profession. And she had lost her life. So these things are not followed by police and the government. So the medical man is not an insurer. He does not warrant successfulness of treatment or cure of patient. So in the past, doctor used to be arrested in table death under section 304A, but now with the decision in the case of Jacob Mathews and state of Punjab, Supreme Court has given guidelines that the doctor should not be arrested under section 304A. That's what I said. If it is 304, it is problematic for medical fraternity. It can be 304A, non-bailable, and police cannot arrest unless opinion is taken from expert doctor or the committee of doctors expert in that particular field. So role of medical legal consultant, doctors are very poor in record keeping. We have been telling, my fellow colleague has already told you about record keeping. Advocate are poor in medical legal knowledge. This is a little bit lacunae. So take care about and avail that thing, cash that thing. Judges, they give decisions as per the record kept in front of them. So whatever the document says, they are giving the decision according to that. Because of poor knowledge of law, doctor is not able to brief the advocate, and so he is not able to plead effectively in the court of law. So the ophthalmologist loses the case, and here medical legal becomes the important in ophthalmic practice, dependent on him, and keep yourself Cool. So about indemnity insurance policies, our next speaker, Dr. Vardhaman, will be speaking about it. At Maharashtra Ophthalmological Society level, we have started the indemnity insurance scheme, and there like group practice, there are group insurance people, they are coming together, availing less amount of premium and more coverage. The same way at Indian Medical Association level, IMA Maharashtra State has got professional protection scheme. There also this professional indemnity is taken care of. So these policies should be taken for doctors and hospital with staff separately and should be renewed every year to meet the claims of CPA. This is very important. You take the policy, you forget for 1 week, and then you renew it. See, the previous particular coverage of that particular period is on. So every year, take care that the policy is renewed before the due date. If you forget that, last 5 years, 7 years, 12 years, that is gone. So thank you so much. So even if there is a notice, don't be panic and try to respond it in a nice way. Thank you so much.
Thank you so much.